Please.
Hear whatever noise.
Right. Okay, so we're all set. Okay, we're going to open up today's meeting of our Human Services meeting. And do we have a motion to accept the minutes of March 30th, 20?
Absolutely do.
Thank you. All in favor?
Aye.
Thanks, Darryl. Good morning. Okay. I'd like to introduce Shelley from LEAP to review Washington County EOC. And
Yes, we actually in particular.
you want to come around and sit next to me?
Thank you for hearing me today. So we have 3 vacancies on the Saratoga, Warren, Washington, or upcoming vacancies in the Saratoga, Warren, Washington Workforce Development Board. We have nominations for appointments, 1 appointment, 2 reappointments for that board that I wanted to bring to you today. So I'll do the reappointments first. The first one is Joseph Sarafini. He is currently the chairman of the Workforce Development Board. His term ends on June 1st of 2022. He's a resident of Cambridge in Washington County, and he's been on the Workforce Development Board for 13 years, and he is on the board as a business appointment representing Cascade Paper. Business appointments are necessary that it be at least 51% of the Workforce Development Board has to be business appointments. With his nomination, we were recommending his nomination, and his 3-year term would be June 2nd of 2022 to June 1st of 2025. The second reappointment that we're recommending is for Scott Brazy. Scott's current term ends on June 1st, 2022 as well. His appointment is for vocational rehabilitation. It's a mandated position. We're mandated under WIO to have a representative from vocational rehabilitation. And his 3-year term would be also June 2nd of 2022 to June 1st of 2025. And then the new appointment is, the recommendation is Dr. Mark Stratton, who is the superintendent of schools in Corinth. And he is recommended to replace Mark Fish, who is the superintendent of schools for Greenwich. Right now, he will be retiring effective July 1st, 2022. But Jim Dexter, the superintendent of BOCES, has recommended Mark Stratton to replace Mark Fish. And we have that actual recommendation. The superintendents involved with BOCES have all agreed to this and believe that he would be a good representative on the Workforce Development Board. His term of appointment then would be July 1st, 2022 to June 30th of 2025. And this is my first time doing this. So if there's something else you need from me or have any questions, I'm happy to help.
Paul's on now. All in favor? Darryl and Paul, were you able to hear?
Yeah, I don't have any questions, Madam Chair.
Thank you.
So Paul says you don't need.
Paul, all in favor?
Aye.
Thank you. Okay, thank you.
Great, thank you very much.
Have a good-
That's a motion to go forward.
Yes. Yeah. And so, Rob, you're up next.
Paul says you no longer need me, is that correct?
Wilson, Skelly, Clary.
You can't call on me anymore. You got her.
You guys can see. Yeah, thank you. You ready? We're glad you're here, Cassie. Okay, so now Bob can go back and sit in his own chair if he wants, or he can sit at the table. It's up to you, Bob.
Oh, if I go back, I'll sleep.
So you can sit right there. We appreciate you being here. Okay, Rob?
Okay, so good morning, everyone. I have 2 informational items. first of all is a first quarter report for 2022 for psychiatric expense line in the budget. Should have a copy of the report in the packet. If you don't, I have extra copies here if anyone needs. So let me know. So we had budgeted this year in this line $100,000. These are the court ordered expenses. They're actually net daily expense court ordered for competency restoration for individuals who are not competent to stand trial. If they have felony charges, they go to a state hospital for a restoration process, and there's a sizable chargeback to the county per diem. Bottom of the table shows the per diem at the different facilities that people get assigned to. So it's over $1,000 a day, adds up very quickly. We have, well, the individual number one went out at the beginning of April. So that individual is no longer in. Individual number two there is still in. It seems like an average restoration period is about 60 to 90 days, but it really varies. You know, some end up staying during 6 months. So what I did is I just put this together to show you that, you know, at the end of quarter one and into March, we, for the restoration, hospitalization expenses were at $129,002. And then also out of that line, we pay for the actual exams. So each court order requires at least 2 examinations, 2 psychiatrists, 2 psychologists do the exams. And sometimes if their opinions differ, then there's a requirement for a 3rd exam. But we pay those at $175 an exam per exam. And so first quarter expenses for the exams were $2,625. So for total first quarter expense at $131,627. The billing for the hospitalizations comes in on a pretty significant lag, a couple of months behind. So we actually just received the February bill. So that's why you don't see a budget amendment request in front of you right now, because I'm really just ready to pay the February bill. And there's enough funds there right now to do so. But I really wanted to have a discussion with the committee about how you want me to handle, you know, the year going forward. You know, I could come back each month with whatever's come in, or we could, you know, kind of pass the state bills for a couple of months and quarterly, come back in June, and see where we are. I do need to make sure I have enough funds in there to pay the exams as the orders come in.
And this, that's something that you would transfer out of contingency, or do you take it out of somewhere else?
When we, depending on where the committee wants to go with it, I think I'd go right to fund balance. I don't think it's our time. This number could be bigger than contingencies set up to.
I know, it's going to slow the contingency right off the bat.
And if it was your desire to just wait and see what the number is going to be, you could just, you know, continue to have the bills being paid, rather than have, you know, every other month have another resolution on the floor. Let the bills go through and get paid until we know, kind of get a handle on where we are, even in October, November, December, and then do one to kind of sweep up.
And as long as there's enough in this account to pay the exams, the exams have to be paid right away, right?
But I think that no matter what's in this account, you advise the clerk of the board's office and the audit committee to process the bills. Let the bills continue to be paid regardless of the budget, and take one sweep of the budget when you're done. You could do that as an option, rather than continuing sending a resolution to the floor, because it's such a fluid thing, as you've seen.
Yeah, we had I was trying to remember that it was 4 or 5 years ago now. We had a real big one. They'd been in for a year or something. It seemed they were transferring once a week.
Which you can do.
Yes, but
it seems it was fairly inefficient.
Unwieldy, more hours coming in and then. Okay. Yeah, that was it.
So as long as you have an understanding to pay the bills regardless of budget, and then do one catch up at the end. And And there's no harm in Rob reporting to you, hey, this is the number,
Yeah, I'll keep coming.
but you don't have to have any action items until later in the year if you want to do that.
And the chairman, audit is kind of persnickety, maybe.
Yeah, Madam Chair.
Yes. Yes, Darrell.
So Al hit the nail on the head, and thanks for that point there. Yeah, I was going to ask Al what his recommendation was. I don't think we have an option not to pay the bill. So it's really just what's the simplification of the bureaucracy to make sure that we're doing the right things to audit. And of course, to the bigger question, what's the recommended fund that we use to balance that at the end of the year, whether that's fund balance, contingency, or whatever. It's something not that we wouldn't kind of do, but in my mind in this committee, but maybe make a recommendation. So thank you for that, Al.
Thank you, Darrell. Any other questions? Do we need a motion to pay the bills and let that's the way it is? Or we just let it be?
I mean, you can always do a motion, then it's in the minutes that we're to go ahead and pay it without the funds available.
It's just a motion to have it in the minutes so that there's an understanding internally that the bills are going to be processed regardless of budget. And budget caught up later in the year.
Second.
All in favor?
Aye.
Thank you.
Okay, the next item is just to announce that many aware that Warren County had issued an RFP for operation and further development of the Adirondack peer-to-peer veterans program. Back in November. The selection committee was put together between the two counties because even though the funding flows to Warren County, on our state aid letter, there's a notation directing that the funds be used for a bi-county program. What this is you may have heard of Joseph P. Dwyer funds. This is the Joseph P. Dwyer funding. And actually in this year's budget, they expanded the program now to all counties in New York State. Previously, it had just been a number of certain counties, they tried to add a few counties each year, but this year they made it across the state. So Warren County receives $185,000 a year for this program. And initially, Rachel and Denise DeRista had kind of worked together. We started receiving the funding, 4 or 5 years ago. And the idea at the time was, well, we would hire a coordinator and keep it in-house at the county. The person would share time between the two county veterans offices. And obviously any community programming would be occurring in both counties and open to individuals from both counties. We went through a few coordinators, and it was a little bit unwieldy in terms of processes for spending the funds and getting approvals timely, for scheduling activities and events. And so the determination was made, let's try going out to RFP and have a community agency or entity operate the program and see how that works. So we did that in November. As I mentioned, the selection committee was put together. Supervisor Clara was part of that, so thank you for that. And we had other supervisors from Warren County as well, and then some representatives from our Community Services Board that have experience with veteran issues. Of course, Ken and Denise were also part of that. And so anyway, the RFP was issued and the responses received from 3 entities. It was SUNY Adirondack respondents, the Adirondack Vets House, and an agency called People USA, which is like a peer-run mental health peer type of an agency. And so the consensus of the committee was to award to SUNY Adirondack. They have a Veterans Resource Center there. They seem well situated to serve both counties. The challenge for them, will be to make sure they bring the program out to the community. It's not as a campus program, a student program. And the committee was very clear with them on that. That's sort of the challenge to that. Also, as part of the RFP, set up an advisory council. And so both Ken and Denise will be part of that council. I'll sit on it. We'll have veterans from the community as part of that. And that will still give us an opportunity then to, sort of give some guidance in the program and how we want to see things operate. So that's just informational. I don't think you need to take any action, but I guess I also defer to you all. You need to formally approve that. Through this county, funds flow more. And
It was I have to say how wonderful it was to work with Rob and Ken and Denise and learn more about the program and what they're able to do. What they will be able to do. It's a great program.
I think open program as well too, somewhere where like logistically as Rob mentioned, there's a lot more freedom as well. Being able to complete outreach and get veterans across both counties involved, especially veterans that are in the extremely rural areas of our counties. SUNY Adirondack has a lot of resources available in that resource center to be able to accomplish that.
How about travel?
I'm excited and anxious for it to get started.
How about travel?
So travel, that is going through the advisory council. That is hopefully going to essentially be a part of that program where mentors, the veteran mentors that get involved in the program will be able to get reimbursed to provide transportation for veterans who may be the mentees that are involved in the program, or transportation to and from certain events that may be coordinated through the program.
That seems to be one of our bigger problems for every program, not just yours, but for everything, getting people there.
Yeah, absolutely. There's some incentive there too, is that if I was a veteran mentor in the program, and I had a few veteran mentees, if you will, under me that were involved in the program, maybe they would rely on me for certain things. Maybe it's just a chat for a little while, but they're having a rough time. And I would provide that transportation, voluntarily. There would be a process for that, but I would provide that transportation to maybe go grab a cup of coffee or a meal, and then in turn bring those receipts back to the program and get reimbursed for those as well.
That's good.
And just one other note about it is that SUNY Adirondack's not really starting from scratch on this. Their county has their programs up similarly. And so they have a Veterans Resource Center out of Hudson Valley Community College that operates theirs. And so the two colleges can work together to help SUNY Adirondack.
So it was a great experience. Ken and Denise worked very well together, and it was a pleasure to watch you guys in action, and especially to us. So,
Thank you. On my end as well. It's great.
so,
Everyone's excited to see what can happen. All right, the last item that wasn't on my agenda, but I just thought I should mention is that I've had some discussions, because I got board in Washington County, had some discussions in Warren County starting about our involvement in the discussions with use of ARPA funding or the opioid settlement funds. And I guess I just wanted to throw out to the supervisors that we do have an infrastructure of a community services board that has subcommittees that involves all of our local providers for mental health, addiction services. And so if that infrastructure could be useful in soliciting projects, vetting projects, making decisions about how those funds can best be used to meet the local needs, then I'd be willing to have that infrastructure serve that purpose. So I don't know what the discussions have been so far in Washington County about those funds, but if you want us to be at the table, we're willing.
We've actually just started conversation about the funds that we're expecting. And I think that would be a great resource, and I think that could definitely be discussed. You would just email me as well. And that conversation needs to continue. So thank you, Rob.
Thank you. Mike?
Morning, everyone. First up is I'm seeking permission to appoint following members to the Washington Youth Advisory Board. Tristan Crandall, Town of Jackson. She's a junior at Cambridge Central School. Tammy DeLorme from the Town of Whitehall, and Polly Monahan from the Town of Hebron.
Moving it, you're moving it.
If you were.
I'll move it this time.
Okay. Any dis-
For the three of them.
The three.
And any discussion about
We were asking, maybe you something. Your side of the room.
I gotta get to the door, I'm not sure.
Block ya.
Daryl or Paul, any questions? Okay. Okay. All in favor?
Aye.
Aye.
Thank you. Second item on the agenda, I want to move to the bottom of the list. I'm going to do a third item, budget amendment request for the Rural Communities of Practice Grant, Phase 3. We received, it was by county collaboration, Warren County, $74,940 to provide program to at-risk youth. Board approved us accepting those funds, and I just would like a budget amendment to include them in my budget. The following amounts would be $18,460 for personnel, $4,615 for fringe benefits, $51,865 for all other, which includes $3,000 for enrichment activities, $5,000 for incentives, $2,000 for vape educator licenses, $15,840 for youth employment, which we would contract with to facilitate, and $2,950 for Search Institute surveys, and $23,075 to go to Warren County for personnel costs. Included, I can skip two and just include that the $3,000 for enrichment activities. After speaking with Al and Melissa earlier this month, I'd like to use that funding and use the cash cards, and only because it allows the flexibility to take advantage of opportunities that come up. I have to come to the committee. We'll keep detailed records as we always have, and I don't have any concern about accounting for every penny of those cash cards. We'd like to purchase them in blocks of $500. And I understand it's been done before effectively in another department. We'd like to try that and take advantage of that. The incentives include the gift cards for promoting positive youth development to reward behaviors that we've already addressed as being at risk for the youth. And these are all 100% state funded.
Any questions for Mike on this?
On the Visa cards, this is for the 1 year to try it and see how it works like that.
I would like the availability to work with administration to do that 1 year. We can audit it back to you. We'll know if there's going to be any problems prior to that, but there won't be.
I'm sure. I have confidence in you.
Thank you.
Just for the committee's information, it's only because right now we're in what I will call phase 1 of the county's procurement card, where we're doing some purchasing with it. As we grow that program, the county will have other credit cards that can be department specific, and those amounts and levels and users and everything can be managed from the dashboard, right? So that's phase two of where we're going. So this was a way to kind of get Mike the ability to do what we will be doing in phase two now, right? So if we had the county credit card for him, that would be what he would be using, and you wouldn't have to have that conversation. But unfortunately, that's the next step in the procurement card. So this was a kind of way to let Mike be able to do the same thing a little bit differently. So just that's why he's asking, because we're not quite ready to do that internally yet. But that's where we'll go. And so if this buys him a year, by year two, we might be in that business and not have to do it this way a second time.
For the introduction. Any other questions?
Ted, do we need to move the budget amendment to finance?
Two different
Yeah.
items. Yeah.
Good morning, everyone. Move the budget amendment to finance.
Second.
Any other questions? All in favor?
Aye.
Thank you.
The purchase.
Right, I'll move purchase cards.
Second.
Any questions out there? No? All in favor?
Aye.
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 Lastly,
Madam Chair, I just, when we get a chance to eventually to see kind of what those incentives entail, I would be interested in that when you finally decide what they should be, and in terms of the types of behavior that you're trying to incentivize, I would be interested in that, please.
glad to share it, Daryl. So when we meet a youth the first time, we do basically an intake that looks at risk levels in their life, wherever domain, could be family, could be negative peer association, or academic performance, substance use disorder, anything along those lines. So we take those risks, then we establish, all right, what's the highest risk? Because we can't fix everything. So what's the highest risk contributing to them being in the system? And we try to find activities building on their strengths and what their interest level is to address that risk factor. So it could be a simple, you went to school 5 days last week, if it's academic, and here's a McDonald's gift card. I know it sounds crazy, but I'll tell you, any reward that we can use to incentivize positive behavior that they're not getting possibly at home, it's a win-win. It's been working anyway. So I'll report out on that later.
Yeah. So the example of the incentive is food, and that's good. For kids, I haven't seen too many of them turn down food.
Well, it could be
Especially a teenager.
like supervisors. I cringe, but Sky Zone's a popular one, and other activities, Great Escape, something along that line. So, and adventure-based activities, if we have equipment to do in a day like that. So there's no purchase of anything. We have everything we need for that. So, all right.
Thank you, sir.
You're welcome.
Thank you.
And lastly, just permission to contract with again this year to facilitate payment of our summer youth program.
So moved.
Second.
Okay.
Any
Any
questions?
questions?
Now we can include.
Any questions for Mike on that? The employment? Yeah. All in favor?
Aye.
Aye.
Thank you. It's a great program.
All right. Thank you very much.
Thanks for what you do. Okay. Public health and Gina, can you hear us okay?
Yes, can you hear me okay?
Yes, perfect.
Okay, perfect, good. Good morning, everyone. The very first thing on my agenda item, I kind of want to skip that. We're waiting on some information from the New York State Department of Health, so I'm not really ready to bring forward that resolution request at this point. So if that's okay with everyone, I'll move right on to the COVID response activities.
Sure.
Okay. So as you've heard, our COVID response over here is changing or has been changing. The numbers continue to climb. We're up to almost an 8% positivity rate for a 7-day average right now for our county. We are still in a low community level per the CDC guidelines, but our neighboring counties are not. And those get updated every Thursday evening. So we'll wait and see what comes out on Thursday evening. But in saying that, going back to our case investigation, the state is winding down their contract with PCG, and that's the company that was doing our case investigation on behalf of the county. So that's going to be winding down on Friday. So we're trying to get out to the community that, they will not receive phone calls if they do test positive. They can still get an isolation order or a quarantine order from the New York State Department of Health website. And they can always call us with questions. We're always here available. We have requested from the state to keep on a school specialist. And that was a request to the schools to help them manage their cases within the schools. And we do have the funding available for that. So the state is working on developing another contract with PCG to keep some of those people on for the counties that have requested that. So I just wanted to get that word out. I know our community has expected a call from either the state or from us if they've tested positive, but that will no longer be happening within the county. So I just wanted to make sure that people were aware of that. But again, we are still here. People have questions, concerns. They can always call us. And we are still doing our clinics on Wednesdays. We actually have a full clinic today doing COVID vaccines and other vaccines. And we do offer that every Wednesday. And we also do have the testing available here. So, if people are looking to get a PCR test, they can come here and get that as well. So that's where we are with our COVID response. Any questions on that?
Any questions from anybody?
Okay. I do have a couple things under miscellaneous. I wanted to get permission to apply for our public health preparedness grant. It is a grant that we get each year. It's a federal grant, but it's passed through New York State Department of Health. This year, the amount is $52,099, and it does start, it's a July 1st start date. So I just wanted to get permission from the committee to move forward with applying for that grant.
So moved, Madam Chair.
Okay, all in favor?
Aye.
Yeah, thank you.
Thank you. The other thing that came to our attention, as you know, we're not a full service local health department. We're a partial service, so we don't handle the environmental here at our agency. It's handled through the Regional Department of Health office in Glens Falls. But we did get a notice last week that they're for enhancing the testing of water in towns and villages that have a public water supply. And by October of 2024, they are going to be requiring a lead service line inventory from each area within the county. And this is across New York State that has water supply within their, I'm assuming would be the villages. So I do have information on that. The Department of Health is having several webinars in the month of May, and they are requesting for the superintendents of those water plants to be on that call to get more information on how they would complete their lead service line inventory. It's really looking at what pipes in the villages or towns might have lead water or lead pipes for their water. So I was going to send that out to each of the supervisors, but I just wanted to make sure that, you knew what it was based on and where it was coming from. And I'll send out the information on those webinars as well. So you can pass that along to whoever in your town would be responsible for that. So that'll be coming. I'll hopefully send that out later today or tomorrow. So you have that information and hopefully can get somebody signed up for one of those webinars. I think they are the same webinar, but they're just offering it 3 different times, so people can get started on that process. And it may be something that your water people are already aware of, but I just wanted to make sure I shared that information. Questions on that?
Anyone have any questions?
Question.
Yeah.
Will that also be sent out to the mayor of the local villages?
Yeah, I can send it to them as well. I just need to get that list. I have all of your contact information, but if I can get that from someone, and I'm not sure if Debbie, if you would have that, I can definitely send that out to whoever you'd like, to send it out to.
I can get it for you.
Okay. Thank you.
Any other,
Sorry.
anybody else? Thanks, Tina. Go
Okay.
ahead.
The other item I just want to make you aware of, the county health rankings came out today. So I'm sure you'll all see those. They just came out today, so I have not had a chance to look at those. So I'll be talking about more again next month. I did take a look to see where we ranked. So for health outcomes, we're 30, this is for New York State. We're 34th place out of 62 counties. And for health factors, we're 32 out of 62 counties. Both of those are better than the previous year, but I want to just dig a little deeper in those. I don't want to get into a huge discussion about them until I can take a closer look at those, and see what they entail. So, but I just want to make you aware that they are out there. They came out this morning.
Thank you. Any questions for Tina on that?
And I think that's all I have.
Okay. Thank you very much.
Thank you.
Good morning, Gina.
First item on our agenda is the request for a budget amendment. As you know, we added 11 routes to our home delivered meals program. To accommodate the needs of the home delivered meals program, I'd like to purchase a vehicle. In March, a bid request went out on the New York State OGS mini bid system for the purchase of a utility vehicle. The bid request resulted in the lowest bid received from Robert Green Auto and Truck Incorporated for a 2022 Ram ProMaster City in the amount of $32,084.83. This is a small utility vehicle that will serve our nutrition program well. To accommodate this, my plan is to use existing stimulus fund dollars already acknowledged in my 2022 budget. I would like to make a request to award the bid to the lowest bidder and also make a request to approve the resolution to increase the appropriation line 6772-2070 in the amount of $32,085, which results in increasing the budget line of 6010-4400. And just to clarify that the revenue in the 2022 budget will still remain unchanged.
Second.
Any questions for Gina on this? Yeah.
What's delivered?
Right now, the dealership is pending the delivery of the vehicle. They do not have the vehicle on their lot.
I'm sorry, I missed the amount that they're trying to raise.
I'm sorry?
What is the amendment to the budget? How much?
$32,085.
But you were doing an increase, I thought. Is it an increase of 32,000?
On one line and decrease from another. It's within our budget, Paul.
Okay. I missed that part. Thank you.
Yeah, I'd like to just thank Gina for expanding the route.
Yes. Thank you. Our pleasure. Yes. Okay. We've got the motion. All in favor?
Aye.
We won't get there till next year though. If the
We still have an adequate supply of vehicles to cover our rates.
Wow.
A lot of happy people from Putnam, right?
Yes.
The next item is really just an update to the committee members on the pre-quote process for the publication and distribution of our newspaper. At this time, NYUT Media, previously known as Manchester Papers, presented the lowest amount And based on this, our department has awarded the service to NYBT Media. We will be printing information that was not only included in our Senior Times newspaper, but also include our information that we send out monthly through our New York Connects program. The information will be printed in a supplement within the free press on a monthly basis. And the title of the supplement will be Community Connections, brought to you by Washington County Office for Aging and Disabilities Resource Center. The exciting piece about this is that the free press really touches on most of the residents in Washington County. So we will truly be reaching a much larger volume of people that we had before with just distributing our monthly mailings and the Senior Times newspaper.
Is there an electronic component to that too?
There is. We will be putting it out on our website, as well as NYBT Media will be posting it on their website as well, and I believe also on social media.
10 years from now, that's going to be more important for them than people right now, probably.
The next item is to share with you that May is Older Americans Month, and every May we honor our senior ambassadors in Washington County. I'm proud to share with you that our 2022 honorees are Debbie Behan of Hudson Falls and Dale Grinnell of Fort Ann. So these are the individuals that we honor through the New York State Office for Aging Award. At this time, I'd like to request a proclamation be made at the full board meeting in June. I would like to have both of the honorees present while the proclamation is being read. And also in the past, we've also provided them with a county pin. They enjoy continue that. I'd like to have that as well.
And that second?
Yep, second.
Paul? Okay, all in favor?
Aye.
Okay. And the last item on the agenda is the presentation of the Office for Aging annual report. I have prepared for you a PowerPoint presentation that Debbie's partner with me. Every year, DSS and OFA engage staff to join in on a photo contest. Staff are asked to submit photos, drawings, anything that commemorates Washington County. The photos, drawings, and artwork is then placed up for vote in an anonymous manner. This year, Kathy McMurray, our senior typist of 20 years, submitted a photo of Sunset Farms in Argyle, which won the honorary status of the 2021 annual report cover for both Office for Aging and the Department of Social Services. As outlined on the screen, OFA and DSS have formed a partnership which makes us an Aging and Disabilities Resource Center, also known as the ADRC. I'll be using the term ADRC and OFA interchangeably throughout the presentation when talking about my department. The collaboration between both departments is successful in providing a one-stop shop for addressing the needs of our community members. Our co-location of staff and the training that they receive from both DSS and OFA and their respective state agencies give all of our staff a wealth of knowledge to provide well-rounded services. Please know that our department structure is very unique across New York State. Moving forward, I'm going to focus only on the programs and services that OFA takes ownership of. The funding of the ADRC is supported by state, federal, and local funds, and also by a few grants. New York State Office for Aging is our official state agency that provides us with our guidance and is our central funding provider. Our federal funds are specialized in that they support the federal government's Older Americans Act. Every funding source has its own set of unique guidelines and rules that include its own local match minimum requirement. For instance, Title IIIe can only be used for caregiver support services. Titles 3C1, 3C2 can only support our nutrition program. The unmet needs funds are for each county to address its own unique gap in services. And the expanded in-home services for the elderly program, also known as ISEP, assist older adults with services that allow them to age independently in their own homes. I'd like to share with you that in 2021, we received approximately $241,243 in American Rescue Plan funding. These stimulus funds were a direct cause of the National Emergency Declaration. During the emergency declaration, waivers were put in place, and we were given permission by the state to use all Title III funds and our stimulus funds in the manner that best suited our department. In 2021, we allocated our stimulus dollars towards our nutrition program for items like vehicles, equipment, and meals. The next two slides highlight our New York Connects program. In 2021, our New York Connects Information and Assistance Program continued to be greatly needed. During the pandemic, based on our knowledge of community resources, it was determined that our New York Connects information specialists were key to connecting community members to available programs and services. This meant making phone calls to community-based organizations and finding out how they were operating and what they were providing during America's pause. From the information we collected, we maintained an online resource directory and created documents like food pantry locations, hours, and food delivery services in our area. Here I've highlighted two data charts from the annual report that shows our 2021 New York Connects data. During the pandemic, information specialists continue to serve the public by providing information and assistance in areas like health insurance and benefits, home-based services, consumer and caregiver support services, residential and housing options, and so much more. The information on the left of the screen shows the contacts we had with individuals 60 years and older and 59 and younger. In 2021, we served almost 3,000 people by either face-to-face contact, phone calls, and email. For obvious reasons, our main mode of contact in 2021 was by telephone. On the right side of the screen, you will see the top areas of assistance provided. As you can see, our primary focus was on connecting and linking consumers with programs, agencies, and services. As I shared with you when speaking about New York Connects data, health insurance information and assistance was the top reason why community members call our office. Here I'm showing you two funded programs that we operate that addresses that need. The left side slide shows our health insurance information counseling and assistance program, also known as HICAP, which provides trained staff to offer information in an objective manner regarding various Medicare plans. On the right side, you will see information regarding our Medicare Improvements, Patients, and Providers Act, also known as MIPA. This program syncs nicely with our HICAP grant, as MIPA's goal is to look for and offer low-income assistance for Medicare beneficiaries. Our HICAP counselors are trained to meet with consumers and determine whether or not they are MIPA qualified. Here is a snapshot that shows some of OFA's core services. I'd like to ask that you please refer to the actual report for a detailed description of each. During 2021, legal services continued to experience a pause. However, our senior transportation services for the visually impaired and our medical alert program revved back up. New in 2021 was the implementation of our telephone reassurance program, also known as our Friendly Caller program. As you can see here, we addressed social isolation and loneliness with 78 Washington County older adults. The calls made to these individuals simply start with, "How are you doing today?" and conversations can go into the direction of how's the weather, how's their family and friends, how are their pets doing, how they're staying active and healthy during the America's pandemic, and so much more. Being a caregiver is truly one of the toughest roles a person can have. Caregivers are most in need of physical and emotional support. We assist caregivers with physical support like respite, daily tasks, meals, chores, transportation, companionship for the loved one, and case management services. OFA provides in-home services with the purpose of giving individuals the opportunity to age safely in their homes and communities. Here I have listed the providers we contract with for personal care assistance, social adult day program, and caregiver respite services. Given the state's restrictions, social adult day services were suspended during most of 2021. As you can see here, our in-home personal care services experienced a decrease in people served. This decrease in people served is truly related to our contracted home care agencies losing home care workers and struggling to hire new staff. Again, I'm not going to go into detail about each of these services shared with you here, as this information is included in the physical annual report itself. In 2021, proper nutrition and accessing food continued to be of great importance. During the National Emergency Declaration, the Home Delivered Meals Program was considered essential, and the state waived eligibility to allow Washington County residents age 60 and over to receive a home delivered meal. This waiver continued until October 2021. In 2021, we covered 10 home delivered meal routes Monday through Thursday and 11 routes on Fridays. During most of 2021, in-person gatherings continued to be suspended, and we adapted by developing and implementing a grab-and-go style meal at our Whitehall meal site. This allowed the meal site manager to continue to make contact with the site participants. Our data shows that we served around the same number of home delivered meals participants as the previous year, and our meal site numbers were still dramatically decreased. Our goal in 2022 is to start back up our mobile meal site program and to reach people that we have not made contact with before in the past. In 2021, we did our best to adapt to the ever-changing environment. This slide shows new programs and services we implemented. Get Set Up is a virtual platform for older adults to access classes, courses for free. Realizing that caregivers have a lot going on, we focused our efforts on caregiving support services. We made caregivers of all ages eligible to receive home delivered meals. To add, we trained our staff to facilitate an evidence-based program called Powerful Tools for Caregivers. I'm proud to say that we held our very first Powerful Tools for Caregivers session virtually in the fall. Being a trustworthy agency for our community members is important to us. We do our best to offer emergency assistance in certain areas. This slide is taken from the annual report and shows a brief description of what those services are. In 2021, we continued to distribute PPE and masks and hand sanitizer. In addition, we also collaborated with public safety and public health and distributed COVID-19 test kits. We also partnered with public health, Kinney Drugs, and Hudson Headwaters by developing a helpline for community members to call and register for the COVID-19 vaccination clinics held throughout the Tri-County area. May is Older Americans Month. It's time to honor and celebrate our senior ambassadors. In 2021, we celebrated Older Americans Month differently. Instead of having our typical statewide celebratory event in Albany, we instead had a virtual live event on Facebook. Shown here are 2021 honorees, Joan Fuller Dagner and Terry Barber, both of Fort Ann. At this time, I'd like to thank you for your attention to our annual report. What I've shared with you today is not all encompassing of everything that we do, so I encourage you to take a look at the annual report itself. The report is posted on our website. You'll also be receiving one now and one in your mailboxes, I believe. So at this time, welcome to take any questions.
Gina, thank you for the report and for the last year that the growth. I mean, it's not a lot of lemonade and a year that was filled with lemons, and you did it. And we can see that in our communities. And I know they appreciate it. Does anyone have any questions for Dan?
Well, my mouse, it would be nice now, so they can get back to their senior centers and get out in public duty.
Back to our public events.
It would really help. And,
So thank you for your kind words. Most certainly, at next committee, I will be bringing up the topic of the senior picnic that we hold in July. I do realize that public events and gatherings are still based on the statistics of COVID. So most certainly it's on our radar to prepare for it. We're starting the process, letting people know, or providers know, and starting to organize some of the events around the picnic in case we're given the green light. Go forward with that.
And I think the importance of our meal program was really identified through COVID. I mean, I think there's more people involved and more people had to get involved. So thank you for that.
Thank you. And it was nice that the state lifted the waiver and allowed anyone over the age of 60 to be eligible for meals.
Another nice piece is the home care check-ins. I think it's through the CVRS and actually going up and address that here is actually doing that at home assessment, so they didn't have to go out. And community check program, yes, was a wonderful, is a wonderful program for people that just can't get out of their homes. It makes it a lot easier to the caregiver and everyone.
And there's a wealth of information going through, I think, for every situation that we all find ourselves in and every day with our people in our community. So it's really good.
That's all.
Yes, and switch seats. Thank you, Kevin. Hello, everybody. What's that?
I know. Oh, me? Okay, yeah, I know that. I also have.
You should be.
This is gonna be kind of DSS light compared to what the ADRC just showed. It's gonna be great.
I'm still looking for Bob in that photo. I can't see him anywhere. Oh, is that him over in the lower right? I think he's chewing on a thistle.
In the same photo. It is a beautiful photo. I think he might be behind one of those cows.
It's place for him, right?
Yeah. He was trying to get it to stay in place for the picture.
Don't do look the photo.
He was trying to tip one.
All right, so I did want to start out by sharing with you the overall mission and our purpose of social services. Gina has certainly given you all the information regarding how our two agencies work together. And I think we mirror each other an awful lot on our mission and goals. Essentially, what I would say, quite basically, with social services, though you may not think so, the goal of most of our programs is to work ourselves out of the job. We have when I thought that through, I wondered, does that reflect that we're not being successful? I think that we are very successful, but I do think that the needs are overwhelming in our community, and I think they get more and more diverse and challenging as time goes on. We do seek to empower people and to help people achieve independence and to be self-sufficient. The overall agency goal is something that we have worked on and strengthened steadily over years, whereas you would view us as one agency or one department. We ourselves are broken up into several divisions and structured in separate areas, and that does become divisive if it is allowed to be. So we understand that it's best for us to maximize our resources when we work together internally across all of our programs, and we do strive to provide services that coordinate rather than unnecessarily complicating
the lives of the people that come to us. A small example of that would be that just a few years ago, we may have had one client that was working with multiple programs, and they could have been asked by each of those programs to come into our office at different times during that week. So we recognize when we started talking about these kinds of things that is completely ineffective for the people that are coming to us. We're certainly making it difficult for them to hold a job or provide childcare for themselves or whatever as well. So that's just one of the very simple things that we have improved on over the years, is as far as us sharing information amongst ourselves to make communication with the folks that we serve much more effective. So this is the big accounting page. This is the chart for a very condensed chart of our budget. It's a comparison of our expenditures to revenues. And certainly, as you would have seen with other departments, and just simply be aware of, the revenues are incredibly high this year. Generally speaking, resulting from most of the COVID-related funding, whether it be the ARPA, or I know that we still have some that was a result of the CARES initiative that happened, I believe, in 2020. So the numbers are quite remarkable. Our salaries and fringe were down. I do think that in large part that's due to the vacancies that we intentionally kept open, as well as the breakage that occurs, particularly when it's difficult to find people to fill the positions. Any questions on any of that?
The Medicaid cost is probably the lowest it's been in how many years?
Right, and so the Medicaid cost, as you know, has been capped and designated to prevent it from unrealistic growth or something that is even more unmanageable for the county. But this year it was cut again, associated with all of the COVID funding and I think it was the EF map.
Yeah, I don't think I've seen it below or that low since I've been here.
Right.
Which will go away.
But
Yes.
that will go, that's where I was going next. That will go away and we'll be back around the 11 million mark, I
It will.
believe, but probably another year away yet.
Yes. Yeah. Thank you, Deb. Just to hit on some of the different areas where the rescue plan really did impact. RAS is the top corner to the right. That is the regular arrears supplement that was funded through the American Rescue Plan, and it was specifically for people that were HEAP eligible to help them if they were in arrears on their utilities. And that is something that was, they were identified to us by the utility companies, and a list was provided to us, and we were then in contact with each of the people to assist them with being able to provide that RAS assistance. And the total payments, as you can see there, were close to 1.5 million for that short period of time. ESG is Emergency Solutions Grant that was funded through the CARES Act of 2020. I think that was the original defense to COVID, and the hope that people that had housing insecurity, that it would provide an additional sort of safety net for people that weren't eligible for our other temporary assistance programs. It did end up coming with some different barriers for us to be able to use it, and I believe that was what then led to ERAP becoming such a big focus after that. So we do have both of those programs at the same time. ERAP, again, was funded through the American Rescue Act, and that was to provide up to 12 months of rent arrears, 3 months of future rent, and 12 months of utility arrears. These charts, I'm sorry if they are difficult to see right now. They are in my report.
It doesn't count for me. I don't see anything,
Okay.
so don't worry about it. I see you.
So the one on the left, there's, if I did that quickly, it's about 24.8 that came into the county in those programs.
Yes.
And about 800,000 of the 24.8 is the county share, is that correct?
It's COVID funding, it's 100% federal.
No, right, so I mean, it's,
Nope.
That's a lot of money that wasn't local money. That's pretty nice.
Right. So yes, you're on the benefits paid out by program.
Yeah.
And so that does show the total amounts that were paid out and how they are reimbursed.
And that's right within the county.
Yes, yes.
A lot of money.
Those numbers are not reflected within our budget. The HEAP money does not flow through our budget. The SNAP money does not flow through our budget. The TA amounts do.
But those are direct to our citizens.
And they're flowing direct to our citizens. And so while we have talked at several different meetings about ERAP, at the very least, if not, talking about all the rest of the different programs, SNAP is one of the things that we have not spoken about much, but that is incredibly high. That value is exact $17.7 million that went directly to the residents of Washington County through SNAP benefits. Usually the number for that is closer to between 11 and $12 million, which is already incredible, but it was increased through the last 2 years in direct alignment with the federal government's increase of up to the maximum rate that everyone could receive. Whereas in the past, if they had limited income, it would reduce what they received. Some of the other categories would be the result of reducing it as well. But this was everyone got the maximum allowed grant, and that money.
Hopefully with inflation, that doesn't come down right away because they're going to need it.
Sure. This is a combination, the charts that are shown on here are a combination of 3 different programs within DSS. The chart on the previous slide that we just talked about shows the payouts for some of these programs. This shows the numbers of the people that have been served. The chart that's on the left and also the one that's at the top right reflect the number of residents that have received assistance through those particular programs, whether family assistance and safety net are the 2 categories of temporary assistance. And they are simply that they're funded differently and for different defined groups. And the child support is something that people do not need to be involved with our programs in any way, shape, or form. It's everyone in the county that has an absent parent from their household would be able to access our services for child support. So the charts that are on the lower right reflect that even through child support, we're pulling back in some funds to offset other DSS costs. So whereas on the previous chart, we talked about the amount of money that was paid out for temporary assistance as one example, some of that money was then collected back because those families would have been receiving temporary assistance, but also receiving child support. So there is a mathematical way that we do collect for that offset. It's the same, also the same that if people owe past due money for child support and haven't paid it, but then are receiving a federal refund or a state refund, or they have won in the lottery, money is also pulled through those offsets to be able to then be paid out through child support. Temporary housing. I've been baffled by this for the last 2 years. I've talked with you about my concerns around homelessness and the moratorium on evictions. Our numbers here are pretty much the same and consistent with what we had in 2020. The lack of affordable housing does continue to be a major concern. We're still sort of waiting to find out what's going to happen. I have not seen a whole lot of movement in the housing market as a result of slightly warmer temperatures and the moratorium no longer being in effect. The numbers that are on the chart on the right, you can see that's how we break out for you of the people that do come to us when they are homeless. Many of them do come to us directly from prison. They may also be sex offenders. And so the breakdown is there showing you what sort of other situations or circumstances people come to us with.
I also wanted to tell you, I switched Debbie, but there was something else I wanted to share. With the start of the foster care recruitment work from this last year, we did shuffle a bit differently the staff that have been working with our homeless population. I wanted to let you know that 2 caseworkers that I previously had assigned to the homeless work continue to be assigned to the homeless work, but we've shuffled them together in with the supervisor that we now have established for recruitment of foster care. So we have a combined unit that we call HOPE. It's an acronym that stands for Homes, Opportunity, Positive Outcomes for Everyone. It really does have a lot of crossovers where we're in search of foster homes for children that need them, and we're in search of regular homes for people that need them. We do keep them definitely attached to different roles that they're doing within their unit, but having the supervision come in a slightly different way through a different sort of background that's more associated with child welfare services seems to be a benefit to us.
When you're homeless, you had 3 families was the average monthly. Is that about where you've been right along? Is that why?
It's about average. Yep. We won't go back anymore, Dave. These are the programs related to child welfare. You see the breakout there for the 2021 numbers of reports that came into our office to investigate. They aren't all that far off from what we've had in the past. Last year, the total number of reports, primary reports, were 1,207. So up here, you can see where it's 1,288. The number of children that were included last year in the reports was 1817. So again, we're pretty close to how we were trending last year. Foster care numbers, you'll see what looks like a number slide puzzle almost. It looks pretty inconsistent with the number of youth that entered care in 2020 versus 21. 2020 was a very unique year for us. What we had in 2019 was again different, where we had 19 youth enter care, but 28 youth were discharged from care in 2019. So it really is an area that's been impacted by the pandemic. People having fewer resources to utilize, larger hurdles to be able to adjust to in their homes before their children can be returned to them. Our number of children in foster care, however, has stayed pretty consistent, and I think it's a pretty good number for us, just knowing historically where we have been in the past. The average number of youth in foster care per month was 39 for the last year. Any questions on any of that information? And prior to the pandemic, every year when I would release the annual report, and Gina's okay if you want to hand those out now, I would also issue an invitation to the board members to be able to shadow any of the programs in my office if you wanted to take a few hours and join one of our workers, perhaps out in the field or in the office, asking them questions about the kind of work they do. We are able to do that. We've done that in the past with supervisors that have had an interest. And so if you are interested, please let me know. Gina's areas are also reflected on the form. And I think that might be in your packets. Yes, it's in the packets that you received today as well. Brian's packet doesn't have the invite. Oh, yeah, I mean, thank you, Debbie. So this will be electronically attached to the website, the county website, and the page for social services. It is the more abridged version of our report this year. Last year was the larger report with a whole lot more narrative. The intent this year was to have it be more data driven and sort of a thumbnail approach to sharing the information that you have there. Any questions on that? It's a better view of the picture of Supervisor Ferguson from here. Previously, I thought maybe he had a deer hanging.
You like, you had to reach
Now
for
you're
a
just
break.
sleeping.
Might be frozen.
Does anyone have any questions?
I think that, I think we have to realize, I mean, DSS has always been a tough thing to discuss with county, and because there's the positives and negatives and everything in between. But I think when you saw that one chart, that it just stuck out to me, the amount of funding that goes to our citizens in the county is way more than what our budget is.
Call us savers.
But I think somehow we have to highlight that at some point.
There's an awfully lot of work that's done.
But I don't think people realize what we budget and what our local dollars are spent.
Yes.
But I don't think they realize the amount that comes into our county. That's a huge number.
Right.
I mean, in fact, the only thing I noticed about your report was when I saw the dollars in the first one, where you put the information, it really should have been in the other one, where the amount that really comes in is way more than we have in our budget. That's a huge amount of money. I don't think anyone, I always forget the reality of the amount of money that passes through Washington County. That makes a big difference for our community if that wasn't here.
Right.
And nobody understands that because we don't see it in the everyday. It's there in the everyday, but we don't realize it.
Strictly considering the 17 million that was paid out through SNAP, the net cost of all of our programs for DSS and OFA together was 3.1 million.
Yeah.
So it certainly is.
Just a huge amount of money.
I appreciate that she included that because the only time I get to see it is in our audited financials.
Yeah.
It has that, there's a little chart in the back of the schedule of federal assistance. It's the only place that I've ever seen the number before, so I really appreciate it.
And I think it's been mentioned before, but I kind of forgotten it. And when I was just sitting there adding it up, and 24.8 million, and the 0.8 was our share. I mean, that is a tremendous amount of money that does a world of good here.
Well, and the ones that weren't, that flowed through our budget, none of it was our share. So
Right.
it's completely into our communities without any county burden. So
Right.
that's, I appreciate that she included that, because that's a huge number.
Yeah.
Huge number, and also you have to have someone that administers all that money, and the value that our DSS employees and Tammy and everyone else does in that department, to be able to administer the money in a positive way to people that makes them have shelter and food, and that's all there, because
There's a lot of really good people
it's
working.
really,
down there.
really good people.
Very much so.
Yeah, we're very fortunate. We can do that.
So we think we'll see another shoe after all of this, the moratorium and the funding for the rental assistance, everything. Once that runs through the pipeline, do you think we're gonna see an initial?
I
Do you
really,
think we'll see any kind of like spike, even short-term spike and then kind of back into a normal?
I keep fearing that we will. But as I shared last month, I had gone and met with and contacted all of the local magistrates, and there's not much in the pipeline either. And the things that were there were on hold because of the ERAP program. So, which is still churning through and pushing out funds to people. So I don't know.
As I begin my foreclosure process, unfortunately, I'm seeing numbers that I'm not.
You might make a spike.
There. That's the guy to do.
But somebody's got to move back into those houses. So,
Yeah.
The SNAP thing is a real concern with the price of food, the amount of elderly in our county.
Because even with the increase.
Yeah, even with the increase, and I don't think people realize, I've been through it with my own parents, but going through it with elderly in my community, and one in general that I worked with that was willing to share information. Like it showed their big cost of living increase and their social security and all that. And she got all done, they took money away from her SNAP
Yeah.
And the Medicaid costs more, so her 6% increase was like $5 or 10 or something. It was like, it didn't, you think 6% is huge, and it was peanuts. Just the way the formula works. And I think nobody gets the reality of that. When I came here 15 years ago, I had no understanding of how the situation worked, but then after going through it all with my parents, that's
Yeah.
where you learn what everybody does here.
And
it's very
I
interesting.
think the work that we've done to have that one door approach has destigmatized an awful lot of it
I
as well.
think so.
In the work that we do to support, the county does to support the home delivered meals program and all of that. We're doing what we can to try to assist people as well and looking at it from that overall view and knowing all of this as well. So, yeah, it's good help that, you talked about the meals, and that's phenomenal. The fact that they've been able to expand in other.
And it was important at that time, and it did. And it's also important that we remember at budget time when we're looking at DSS and the amount of people, the amount of money that they flow through the county is way above what we see in our budget. That's just phenomenal.
Speaking of money, I have some resolutions.
You're looking for something.
And are they in the packet as well? The resolutions?
I believe they are.
Okay. So the first one is a pot of funds that came through again, resulting from the American Rescue Plan. It is designated to serve the Adult Protective Services area, which would be workers that are directly working in Gina's division. And you, through OFA, also received a similar pot of funds, I believe. Yes. And so we're looking to globally manage these in the same way, though of course we will track what the spending is and have everything that we need to have in terms of an audit trail. But we would like to amend the 60, 70, 42, 90 services for recipients category to increase it by $13,065 and then put the same amount of revenue into the federal aid, this is 100% federal dollars. It will be used to provide goods and services to older adults and people that we are serving in ways that we can't help them from other programs.
So moved.
Second.
All in favor?
Aye.
Thank you. The second is a lot larger. It is also, though, related to the American Rescue Plan. These funds came through tagged for being related to the administration of Heath. It is far more money than we have traditionally seen for the administration of Heath. We also have received other Heath admin dollars. This money is amazingly flexible for us to be able to utilize in terms of supporting our overall programming and functioning within the department.
Nice work.
So we are seeking to do several different technology upgrades really throughout this building, but starting with our training rooms and then spreading out to other rooms that we are able to have access to for DSS staff and meetings, to include some of the space upstairs. We have furniture and chairs that we would like to replace. An example of that is the desks and chairs that are in the interview rooms where we meet with clients are the same ones that have been there since the building opened. I suspect they probably came from the offices in Granville at that time. They're kind of shabby. In addition to that,
Do they have slate cushions?
no, we do not have slate cushions.
They're just that hard.
We also are looking to replace some of our scanners because we do image we image the majority of paperwork that comes through our office, try to not have that on shelves any longer. And some of those scanners need to be replaced. And then looking at upgrading printers, color printers. And then we still have some iPads that would be a benefit to replace. So it's a variety of sort of a catch-all of categories. I have spoken at length with the county administrator. We have met with the treasurer as well as the chairman of the board and the chairperson of this committee, looking at different ways to be able to spend this money out to use it for the best advantage as we can for the county. And what we are asking to do is to put the full amount into a revenue code that you will, is it something special created at 60, 10, 46, 41? Is that always the same?
That's your existing.
Okay, and then we will have an account assigned by the treasurer for the 0.2s and 0.4 breakout that we will then manage, similar to a grant, where we'll be able to have a full tracking of how this money is spent, and quite possibly no, this money has to be spent out before the end of the year.
So moved.
This money has to be spent out before the end of the year.
This is the September one.
This is the September one, yes,
So this is pretty quick turnaround.
yes.
We had asked Tammy to consider treating it like a grant recognized the whole award. So this is kind of a stab at the split between 0.2 and 0.4. So don't be surprised if somewhere along the path, she comes back and has to kind of switch between the two, because I've asked her to kind of recognize the whole award up front with the ability to kind of be flexible later on. If the plan comes to fruition and it turns out to be more equipment and less contracted stuff, then we may need to move the money, but I thought it best to recognize the award right up front.
I'll second it.
Yep.
So, Cassie made the motion, Jay seconded.
Brian did.
Brian, I'm sorry, thank you. Is there any questions? Daryl? Paul?
No, Al answered that. It can't be carried over. Understand.
Thank you. Okay, all in favor?
Aye.
Thank you. And the last is the money that had been targeted in the county plan for the ARPA funds that had been received last year. It sounds to me like you're talking about new funds for this year. I don't know that to be true. This was the, at that point, it had been designated as $288,160 that is in fund balance.
Yes.
And we would like to move that into also an area where we'll be able to track all of it as a whole. We will be using it for foster care recruitment, as well as trying to enhance the number of child care providers that are available in the county. There are some specific things that I would need additional permission to be able to use this money to purchase. For instance, we would like to be able to provide food, excuse me, at the trainings that we have for foster parents as they are going through these classes. It's typically 11 weeks and held at night. So we would like to be able to have a meal for them. So I would need a waiver on that. We also would like to order some promotional materials to be able to spread the word that we are once again recruiting and certifying foster homes. I'd like to be able to use the logo on that. And then, similar to what Mike had talked about in a different area earlier, we also would like to be able to provide incentives. As I've talked in the past about recruiting foster homes, I've also talked about doing things that we really were never able to do in the past with them, where we were engaging them, providing incentives to them for things that they can do with their family, as well as once they have children that come into their care. Some of the things that we'll be providing them could be as simple as a first aid kit. It could be a lock box for the medications that they would be storing in their home, but it could also be gift cards. So I'd like to be able to have the approval to be able to do that. Other areas that we're going to focus the funds on would be to have our training supplies and to be able to do outreach. For instance, we need to buy an Easy Up to be able to take our show on the road when we're trying to recruit interest in foster parenting.
So moved.
Any questions from anyone?
With everything.
Yeah, is this, I have one question for Tammy.
Hi there.
So the sustainment of this program, obviously, it looks like we're going to jumpstart it with I believe, the ARPA sustainment, looking to sustain that over time. Is there a plan for that, or?
Right, so when we did hire extra staff, and we have talked about the sustainability of that moving forward. Currently, the homes that we are using for foster care and for the children that come into care are traditionally, our first call would be to Berkshire Farms, and we would be paying them a higher administrative rate to then do the caretaking and planning for our children. It will take time to sway that around because the children that we have in their homes are still going to be in them. And quite frankly, if we have a new child come into care today, we'll probably also be calling them to place that child. But as time goes on and we have more of our own homes, we will be placing our children in them. And so that administrative fee will be the part that we see recede, and how it will be sustainable because it is our own staff. Providing the incentives and like meals at the trainings, that sort of thing, that will be something that we will need to take a look at. I believe that this will cover us for the length of time that this money can be spent out, which is, I believe, through the end of 2024. So it would be a beautiful thing to think by then we've done a great job and have tons and tons of foster parents, but it'll certainly be something that I keep you updated on.
Thank you, Tammy.
Any other questions for Tammy?
You talk about food and things. Is there an opportunity for local businesses to take part in that and maybe sponsor part of the training where they would provide food or cater or something that might be a more community thing that would get a better response, I guess?
Yeah, that brings to mind that in the past when we would have a foster care picnic, we also had a Christmas party, holiday party for all of the families and the children that were in care. And at that time, we would go out and actually seek donations and prizes or gifts from different businesses. We can certainly
But I
do
could
something
see
to make
where,
that available.
you take like a Stewart's or Market 32, they're family-run businesses to start with, might take an interest in sponsoring something like that. I guess.
Yeah, I'm hoping that we'll be able to do a larger campaign for recruitment and get more of this in the public eye. We have been talking, Melissa and I, as well as in the meeting the other day, about kind of going outside of the way we traditionally have tried to spread the word on things such as recruiting for foster parents, such as recruiting for staff. So doing something that's a bit more current and will be something that people will see more so than our traditional use of recruitment has been in the past. And if we can at that point capitalize on any opportunity to have sponsors for things, we certainly do that. So with this, there is the permission to provide food. That waiver has come through. There is the permission to use the logo and purchase promotional material. And there is the permission for incentives, which may include gift cards. Got that, Deb? She says you still got to vote.
And then we got your results.
Yes.
Thank you. So did somebody make a motion to?
Brian did.
Right. Okay, then all in favor?
Aye.
Thank you very much. Thank you.
All that I have.
We do, did you already hand that? You did hand that out.
Yeah. Okay, and is there any other business for us? No? Then this meeting's adjourned. Thank you very much.
Everybody have a great day.
Yeah. Thanks for coming.